Well, who's a candidate for implant reconstruction? I think any patient can get implant reconstruction, but the ideal candidate who would get the best results are, women who have, smaller breast size. I would say A to a D cup. Also, women who are good candidates for nipple preservation are excellent candidates for implant reconstruction. The procedure can be performed in 2 stages where a tissue expander is placed first. So you can think of the tissue expander as a balloon. So the tissue expander is placed first, and then the patient is expanded over a period of time. And once the desired volume is reached, then in the second stage, that tissue expander is removed and an implant is placed. Or we can also do a single-stage operation, or what we call a direct-to-implant, where an implant is placed immediately at the time of the mastectomy, and that can be performed in certain patients. There are different type of implants available in the market. You have different sizes, shapes, and volume fill. There was obviously a silicone implants and saline implants. And the silicone implants, they have a more natural feel to them, and they're softer. And they're the most commonly used implants. The type of implants and the shape and size of implant depends really on the patient's dimensions. So we pick the implant for each patient depending on the volume they're going for and also on their dimensions. It also depends on the look the patient is going for. For example, a gummy bear implant has a more natural slope in the upper breast, while a round implant has a fuller look in the upper breast. The procedure doesn't take as long as a flap reconstruction. It's less time, less recovery, and the patient doesn't have to deal with another incision, placed somewhere else in the body.